Cardiopulmonary Resuscitation and Defibrillation, CPRD training. Check the surroundings. Check the scene and the person. Make sure the scene is safe, then tap the person on the shoulder. Shout, "Are you okay?" to ensure that the person is unconscious. If the person is unconscious, call or ask a bystander to call the emergency number. Send someone to get an automated external defibrillator, AED, if available. With the victim lying on his or her back, tilt the head back slightly to lift the chin to open the airway. Check for breathing. Check whether the victim's chest lifts and lowers regularly. Listen carefully by placing your ear close to the victim's mouth to listen for breathing until 10 seconds. Attention! The person may be taking infrequent noisy gaps. This is not to be confused with normal breathing. If there is no breathing, begin Cardiopulmonary Resuscitation, CPR. Knee beside the victim. Place the heel of one hand to the center of the chest. Cover the first hand with your other hand. Interlock with fingers. Position yourself so that your shoulders are directly over your hands. Keep your arms straight and lock your elbows. Give 30 chest compressions. Push firmly downwards about 5 to 6 centimeters. Push fast at a rate of about 100 to 120 compressions per minute. Keep your hands on chest and allow the chest to return to its original position per compression. Once you have given 30 compressions, prepare to give 2 rescue breaths. Use the head tilt chin lift technique to open the airway. Pinch the nose shut and place your mouth over the victim's mouth to make a complete seal. Blow in for about 1 second to make the chest clearly rise. Give 2 rescue breaths. Repeat chest compressions and rescue breaths until an AED is delivered for defibrillation or an ambulance arrives. If the victim is lying in water, move him or her to a relatively dry area before using the AED. Open the AED box. Turn on the AED and follow the visual and/or audio prompts.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
If the skin is wet, be sure to wipe the victim's chest dry before placing the electrode pads. If the victim is wearing a bra, remove it before placing the AED pads. Apply the electrode pads of AED to the corresponding positions. Plug in the connector if necessary. Make sure no one, including you, is touching the victim. Tell everyone to stand clear. Allow the AED to analyze the victim's heart rhythm. Push the Analyze button if necessary. If the AED advises to deliver a shock, tell everyone to stand clear and make sure that no one is touching the victim. Once clear, press the Shock button if necessary. Immediately begin CPR after delivering the shock or if no shock is advised. Continue to follow the AED's prompts. Continue CPR until the victim exhibits obvious signs of life, for example, breathing. Or when EMS, Emergency Medical Services, a trained medical responder arrives. A collaborative initiative by French Red Cross, Global First Aid Reference Center, Philips Design, Philips Foundation.